We mark 8 months since the start of the war in Gaza. Just yesterday, an Israeli airstrike hit a United Nations school that was inside a refugee camp. 30 of the 6,000 people being housed there were killed. Some of them were children. One person who knows the area and the devastation all too well is emergency medical doctor Ahmad from the Chicago area nonprofit MediGlobal. Doctor, thank you for taking time to be with us this morning.
Thank you for having me.
So you were in Gaza in January treating mass casualty events like this one. Can you just share some of what you witnessed day to day in between these reported strikes that we're hearing about here in the States?
I mean, it's truly horrific, and the nightmare is never ending. I mean, the concern is that while there are these intense raids happening, there's bombs that are taking place that are leveling neighborhoods and street by street. There is all of this infrastructure that's being damaged. There's also a blockade that's not allowing humanitarian aid in. So when I was in the hospital and we were seeing mass casualty events taking place, 15 to 20 people coming in at a time every hour, every couple of hours, the other concern was we don't have the supplies to treat these people. I don't have the pain medicine to help the child that's in agonizing pain. I don't have the sterilizing equipment that I need to make sure that a wound from an airstrike doesn't get infected. And these are all things that are compounding. So when you hear about the fact that there was a school where people were sheltering, had an airstrike in it, and that there were 40 people dead, I also think about the people that somehow miraculously survived that airstrike and where they're going to go and how they're supposed to receive this treatment. The hospital that they went to in central Gaza has 700 patients. It's over 3 times capacity. Where are we going to put all of these newly injured people? And I will say, we just heard from our team on the ground that another UN compound where people were sheltering was hit and 5 people were killed in this event. I mean, this has to stop. There has to be a ceasefire. We have to be able to get medicine, food, water into the Gaza Strip. And I would remind everybody that there are around 10,000 people stuck in the Gaza Strip that need to be immediately medically evacuated. They will die waiting to get out of the Gaza Strip.
It's so difficult to hear, as doctors, not having the necessary, tools and aid you need to help, especially, a child, a family member coming in. So the International Rescue Committee says right now that Gaza is the most dangerous place for aid workers right now. I know you just said you're in communication with your team on the ground. What else are they telling you about the need there right now?
Yeah, I mean, it's truly catastrophic because not only is it really dangerous for the team to be able to move, it's also the fact that they're not able to get the desperately needed supplies that they need. The hospital that I mentioned that received all of these patients that are injured, they have 2 generators that they are operating where the hospital is able to operate. One of them is out of commission, out of service. They need diesel fuel to get to the Gaza Strip, but it's too dangerous to be able to bring it from one of the borders all the way to central Gaza. I mean, this is the concern that we continue to hear about. You remember about the World Central Kitchen aid workers that were killed? Well, there are over 200 UN workers that have been killed in this conflict. And we know that over 400 healthcare workers have been killed in this conflict. It truly is incredibly dangerous for anybody who's trying to access the most vulnerable people, to try to bring some sort of relief to the suffering that's ongoing. And I think that that's part of the problem here, is that it seems like there are no limits and there are no red lines. And so I think that's something that needs to be addressed. I know that you, at the beginning, you mentioned that there were sort of maybe stumbling blocks within this ceasefire proposal. I mean, at this point, there just needs to be a pause. There needs to be a ceasefire, because I'm not sure how much longer people can continue to live like this. I mean, it truly is hell on earth. And that's something that I'm very concerned about. And I think that we hope that we can communicate this urgency and not normalize the attacks that we're hearing every single day.
And quickly, I just wanted you to touch on, you traveled to D.C. recently. You spoke with lawmakers about the humanitarian crisis in Gaza. Did you get any hope from that conversation or those conversations that you had while you were there?
No, I honestly didn't, and I'm sad to say that. And the reason for that is I think this issue here in the United States has become so political. And part of my job as a physician, as somebody who's observing medical neutrality, is to communicate the urgency, the humanitarian crisis, and truly just how catastrophic the situation on the ground is. Unfortunately, because of politics, it's fallen on deaf ears. And I hope that people can rise above that. I hope our lawmakers can rise above that and truly understand how tragic the situation is and how much work is ahead of us even after a ceasefire.
Yeah, here stateside, I mean, you could see images, you can hear the news, we can share it, but it's hard to even grasp what the devastation is there. Thank you for sharing it with us. Emergency medical doctor Thayer Ahmad with the Chicago area nonprofit MediGlobal. Thank you for your time this morning.
Thank you for having me.